So what I did was I contacted the people who were here till 9 o'clock on Friday and said, this is the hospital priority. If we have float nurses available, nursing resource team, the first one that we have available will go to Emerge to relieve Emerge so Emerge can screen. That's a priority for now, for the weekend through to Monday. So in other words, if they have 12 nurses to distribute and they have shortages of nurses on one floor, that nurse still goes to the Emerge department, so an Emerge trained nurse can be a screener. I think it's important, and I was actually kind of pleasantly surprised because the powers to be above me at home thanked me for that. Sometimes my role's a weird one. There's a lot of communications, a lot of meetings on days and things like that clear. But it's funny, at like 3 in the morning on a Saturday night, the way forward is usually pretty clear. The way to deal with stuff is usually pretty straightforward, and I thought it was important. So that's what I've done. I know other hospitals in the GTA are doing similar things. One of the problems is that health is provincial in Canada, a state if you like, and each hospital is private. So each private hospital is public. So we have a provincial Ministry of Health that's actually doing most of the work on this. So there are differences between the provinces. So I really would prefer it if Health Canada, rather than Justin Trudeau just formed a committee to chat about it, actually took some more dramatic lead and made more clear national health guidelines. So nationally, this is the rooms we will use. Nationally, this is when we will cut elective surgery. So it's much more of a cohesive thing rather than ad hoc. Now when I say ad hoc, don't get the impression that we're not planning ahead, because we are. And we are planning for doing as much as we can do for as long as we can to maintain current, normal hospital operations, because people still need to have their hips replaced and people still have heart attacks, and unfortunately in Toronto people still shoot each other on a fairly regular basis. But there might come a time, and that's a might come a time in the next week or 2 or 3 or 4, where we're unable to function normally due to volume overload of pneumonic viral patients from COVID-19. So at that point we'll have to do things differently, and we are looking at unconventional space, different staffing models and a whole bunch of things. So a lot of you I know are Americans, and I know a lot of you are also English. The English stuff on this is quite dramatic. The British government are planning for 300,000 dead, worst case. They're planning to bring volunteers into the hospitals. They're planning to bring St. John's Ambulance into the hospitals. It's actually really interesting what they're up to, and I'll throw up a Guardian link for that and you can have a little look. That's the level of advanced planning proactively I'd like to see Canada be doing, openly and publicly. I'd like to see some definitive ideas being kicked around that could be used if we get overwhelmed. Rather than get overwhelmed and then try and handle that, we need to be thinking ahead of the game. And that's what I would like my hospital to do, and it is mostly doing that. That's what I'd like my provincial health authority to do, and mostly they're doing that. Not as openly as they should be, but I get why they're frightened. But the other thing is that Health Canada has actually put out a whole bunch of guidelines about this, and they're absolutely fascinating. And when I'm at home, I'll actually string it together and put it up as a video. It's quite interesting. It's all very sensible things like planning your shopping around non-peak times, altering your transit to work if you transit to work, public transit, at more off-peak times. In other words, to try and increase social distancing. And they're recommending this if COVID-19 becomes common in your community. What I'm recommending is that you take these steps now and provide social distancing and reduce your personal risk of catching COVID-19 as much as you sensibly can now, before it becomes common in your community. When it's common in the community, that may be the point in time where you've already caught it. And that's my concern as an individual. Now, as a healthcare professional, and I'm going to do a video on this for healthcare professionals faced with COVID-19 and insufficient personal protective equipment, is what I'm doing is I'm carrying swim goggles for both myself and Kitty while we're at work, in case we have to intubate somebody. I'm not convinced that a plastic face shield is enough. Definitely put one of them on, but I also want the goggles. In my role, I have to go to every cardiac arrest, and Kitty currently is working as a rapid response ICU nurse, the only one, so anybody sick in the hospital she goes to. Wherever possible, we're going to try and transport people to negative pressure from the ICU to intubate them, but that may or may not happen depending on bed availability and how sick they are. I'm also carrying a small but limited supply of kiddies' masks. My masks are still common and available, so I'm not carrying them. I do carry one in my pocket whenever I go out and about in case I feel the need to put it on, and so far I have not felt the need. The other thing that I think is really important for healthcare professionals, paramedics, police, funeral directors, etc., to take on board right now is your employer may not be able to provide you with personal protective equipment if widespread local community outbreak occurs. So what you need to do before that is to make sure that you have adequate supplies of personal protective equipment. Now, something as simple as a gown, getting 200, 300, 400 trash bags right now won't cost you a lot of money. Don't think there's much panic buying for trash bags, and you can use them as a single replaceable gown. So that alone would help. Having enough gloves probably won't be a problem, but you might want to think about having 3 or 4 pairs of gloves that you could use for work that you can, say, wash and look after and do it that way. In terms of the N95, this is the gold standard. It will reduce dramatically the chance of virus entering your mouth and nose and getting the infection. And I'm absolutely sick to death of people saying masks don't work. Masks work just fine if they're N95 or higher and fitted. So one of the things I'm going to do once I finish this span of nights is I'm going to try laundering a few of these, and I'm going to try reusing a few of these. My plan is to actually, in an outbreak, is to carry Ziploc bags, put one of these on and leave it on for 6 hours at work, change it at the 6-hour mark and rehydrate at the 6-hour mark as much as I can, and put the used one into a Ziploc bag and seal it, and then put that into another sealed larger Ziploc bag, and then leave them there, and leave each bag in there for a long period of time. And in fact, put the bags in the sunlight very early on and leave them there, and after 2 weeks, very carefully mask and gowning, open them up one at a time, spray bleach in, seal them up, leave them again for a little period of time, like an hour or two, and then hang them on the line to dry. And I don't know how long I can keep that process going. What I know is having a possibly faulty N95 is going to make me a lot happier than walking in a room with a surgical mask on. I'm telling you that right now. Like I said, I don't think it's going to fly, telling experienced, trained and intelligent nurses that they don't need N95s to go in COVID-19 rooms and give care. That will be a very interesting thing to happen. I'm hoping we don't get there. We do have large supplies of masks, but looking forward at probable use, we don't expect them to last. That is the problem. That's it for me, except to say that I did inform Kitty that the government of Canada is telling her to consider going to outdoor exercise rather than indoor exercise. So now she's desperately upset because she loves her yoga, but I think she might want to start thinking about doing that. I've been asking her not to, for a couple of reasons. One, if you are in a crowded room with people for a period of time and one of them is infected, you might get infected. So for purely selfish reasons, it's not that smart a thing to do, even if it's not in your community right now, because it could be, you just haven't had cases develop yet. But the other thing is, from our point of view as healthcare workers, if Kitty gets COVID-19 but isn't really that symptomatic, and she goes to yoga and 2 or 3 days later she's diagnosed with COVID-19, everybody in that yoga studio has to go into quarantine. Everybody in that yoga studio is going to be very, very frightened. Limiting contact during an outbreak is absolutely essential. When the governments shut down the cities or the province or the country, it's too late by that point. It's already in the community on a large scale. You owe it to me to limit your ability to catch this disease, not just for a selfish reason, but each person that avoids catching it is one less person to pass it along. Not everybody's going to get this. People are still rambling on about numbers and death rates and all the rest of it. It really doesn't matter. What matters is that you do what you sensibly can right now to prevent yourself and your loved ones catching this disease as far as you can, so you can't be part of the chain of infection, so you can limit the spread in a small way. Alright, this is Huples Cat at work. I'm going to lie down now because I'm really tired. Toodles.
As you know, over the weekend we crossed 100,000 reported cases of COVID-19 in 100 cases. It's certainly troubling that so many people and countries have been affected so quickly. Now that the virus has a foothold in so many countries, the threat of a pandemic has become very real. But it would be the first pandemic in history that could be controlled. The bottom line is we're not at the mercy of the virus. Of the 4 countries with the most cases, China is bringing its epidemic under control, and there is now a decline in new cases being reported from the Republic of Korea. Both these countries demonstrate that it's never too late to turn back the tide on the virus. The rule of the game is never give up. I'll repeat that. The rule of the game is never give up. We're encouraged that Italy is taking aggressive measures to contain its epidemic, and we hope that those measures prove effective in the coming days. Let hope be the antidote to fear. Let solidarity be the antidote to blame. Let our shared humanity be the antidote to our shared threat.
This was a Bad Terrier 2020 production.